I'm Nico Moshe. I'm a professor of neurology, neuroscience, and pediatrics at Albert Einstein College of Medicine and past president of the International League Against Epilepsy. And my passion is to help people with epilepsy.
I'm Ed Bertram. I'm a professor of neurology at the University of Virginia in Charlottesville. I've been involved with epilepsy for close to 30 years now, and it's been a wonderfully challenging and very rewarding field to be able to work with people and to help them with their epilepsy.
So we're here at Epilepsy Awareness Day 2016. Tell me, why is it really important for people to talk about epilepsy and bring it out of the shadows?
So Sam, we are out of the shadows already. We would like to go to the limelight. We would like to be the forefront of what we do about epilepsy. About 10 years ago, the WHO had a big campaign to be out of the shadows. We got out of it. However, we are not in the forefront, and we need to make that huge step. It's like people with epilepsy need to come out. I have epilepsy and I need care and treatment. This is the problem that we are facing now, because people with epilepsy are afraid to say that they have seizures.
Yeah. Ed, what do you think?
I think that's absolutely true. One of the good things about this kind of a meeting for people is that they really get empowered. They understand that they're not alone, and that they have common problems with others that they want to work on, they want to solve, so they have greater opportunities.
Tell me about your talk here at Epilepsy Awareness Day. What is your subject?
So Ed will start because he gave his talk already, and then I'll follow.
Yeah.
So I talked about what actually, after someone gets the diagnosis of epilepsy, what should they be thinking of? What kind of questions should they ask? What should they be expecting long term? And it's a situation in which they often don't get a lot of information when they first come in, and they just need to have this information. So my talk was mostly about what can they do if things aren't going well, then to make things better.
My talk is along the same lines as Ed's. First is to diagnose epilepsy and being able to give a name to what the condition is. It turns out that epilepsy is not good enough. We need to be specific for what the person has and how this is going to help the treatment. But more important is to try to figure out what we can do in terms of the society and organizations, whether we're dealing with governmental organizations or non-governmental organizations like the WHO, and the society level, to integrate people with epilepsy so they can have a normal life and provide cures. And in order to provide cures, you need more research. More research to identify causes and treatments, but also the people to come out and say, we want these treatments. They should not accept that they have epilepsy and there is nothing can be done about it. We can take care of 2/3 of the people with epilepsy. We want to take care of everyone.
So there's something that's can be done with, as you mentioned, research in genetics. Is that a fingerprint that you can see epilepsy, identify epilepsy from?
At this point, the causes of epilepsy are multifactorial, and genetics is one of them. But you can have a genetic background and may not develop epilepsy. So we need to understand what are the circumstances of genetic, epigenetic, and environmental influences that they play a role in the expression of the disease, and then provide individualized treatments to help the people. In order to do that, we need more interest from the people about epilepsy.
Okay.
So the problem that we have is that in Parkinson's disease, you have a very famous actor who developed Parkinson's disease at the age of 35, and suddenly everybody knows about Parkinson's disease. In epilepsy, we do not have this spokesperson. We need that spokesperson to come out and say, I have epilepsy, do something for me, and here is the way to generate funding. Epilepsy is much more common than a lot of other diseases that get a lot of funding from different organizations, but we get very little. One of the reasons is that's a disease of young people, and young people do not have the means of going to the governments and say, change it. That's why we need to change the mentality. And there's some organizations that already have played a tremendous role. The American Epilepsy Society, the Epilepsy Foundation, most importantly CURE, which there is a booth here, has changed, but we need more. The funding for epilepsy is about 1/10 to 1/20 of what is for other diseases, which are much less common.
One of the big problems, just to echo some of the things that Nico was saying, is that epilepsy for so long has been an invisible disease. People don't want to talk about it, they don't want to admit to having it if they have it. Even though there are a lot of well-known and very famous people who have the disease, they're not talking about it. Whereas, as he said, if people have other diseases, they're out there in front advocating for it. So I think one of the most important things is to make epilepsy, more visible, as we said, but also to make it more acceptable, but also for people to understand how much it costs the patient, how much it costs society, because that's just not well recognized.
No.
Again, all the costs of epilepsy are hidden in many ways.
I mean, for me as a patient with epilepsy, there's medication, there's then also care, and also research, and also all the tests. For example, video EEG, MRIs, and that's kind of like just the beginning. But to make it individualized, does that mean you've also got to get the medication right for the individual?
That's correct, and that's why we're still doctors and not just electronic medical records, because we can make it better by talking to people like we're talking right now, so I can find out what works for you that may not work for another person. But in the hidden costs that you're describing, also think the days that they're lost from productivity, either because you cannot work, because you had a seizure, or because you cannot go to school, so you do not learn, so you're not going to have an opportunity to have a job, you may not get married, you may not be able to drive. And for all of these people, we may make the difference. And we can make the difference if there is more public interest.
Okay, so how do we get that public interest? Is that via TV, via radio? Is that via government? You've already mentioned government. You mentioned the World Health Organization. And that's a big organisation, but most of the public don't engage with them. How can the public talk about epilepsy via media and radio?
We need a person with epilepsy that's very prominent to come out and say, I have epilepsy, and see how my life is changed, for the better or the worse. But people are afraid to do that because epilepsy is associated with a stigma, so they hide it. There is a very famous soccer player that has threatened to sue us if we reveal that there is epilepsy in his family.
Right. Okay. So
in a lot of countries, people go to great lengths to hide the fact that they have epilepsy. They don't want it publicly known because it will keep them from getting a job.
Yeah.
It will keep them from finding a marriage partner. And it's because there is so much stigma, so much ill feelings about epilepsy, and so much superstition about the disease that I think we have to do two things. We have to first normalize it, to say that, if you have epilepsy, you're still normal.
It's easy now these days to say, okay, I have a cold, or even to say, to talk about, people will say, I have cancer. But yeah, epilepsy is a problem. When I mention I have epilepsy to people, they either ignore me, they don't want to listen, they'll walk away. And not to accept the facts, they'll just ignore that I have epilepsy and brush it aside.
In Japan, you do not mention the word cancer. If you have cancer, your doctor is not going to tell you have cancer. It's a hidden disease. The same way that cancer was a hidden disease 40 years ago. It's not anymore. And the reason that's not anymore is people with cancer came out and said, do something about me. People with epilepsy don't do that. And the reason that they don't do that, as I mentioned, is because what it affects, epilepsy can affect the very young people or older people that they don't fight.
Yeah.
In order to make the fight go ahead is that you have to get the parents to say, my kid has epilepsy, I'm gonna make the difference.
Yes.
And it's not only for my kid, but it's for everybody with epilepsy. We need ads on TV before the Super Bowl or any other major event. Talk about people with epilepsy. We don't have that. We have not been able to identify a champion to help us. There is a booklet, if you come by, that we created through the LAE with sports people who took pictures with people with epilepsy. We thought that this will increase the awareness. It didn't do as much as we wanted.
Okay.
Because, again, we had to make sure that the athletes did not have epilepsy, the majority of them, but they were afraid that they could be associated with it. So we need people to come out.
It's one of those things that there may be an occasional mention of epilepsy in the press, but then it disappears again for months. And it's not like cancer, or it's not like heart disease, that there's something about the disease in front of you every week.
Yes.
And that just doesn't happen with epilepsy. And I think we have to have a way of making it a lot more just in front of people all the time, so that first that they sort of recognize that it's a problem, but also realize that it's a problem that can be fixed and helped, and that there's no reason to ostracize anybody who has epilepsy. All of those things need to be there so that people just sort of know that epilepsy is there, that it's a major disease. And it's one that we can treat, but it's a major disease.
So finally, why is it really important for people to come to events like this, to Epilepsy Awareness Day?
To get the spirit, essentially, to get energized and to realize that they have a common fight. Everybody here has a common fight that they will all benefit from if they join in.
And also they can go to the congressperson and say, do something about me. I think that's very important in a time that we have elections, to get people who understand what epilepsy is. And if we manage to get the star here, we'll take pictures of him and say, I will talk about epilepsy and how well I'm doing, or how much I'm going to help for those people that they don't do well. That would be terrific.
Change in epilepsy will come when the patients and their families are energized enough to make a difference. We can help, we can provide advice and suggestions, but they're the ones that will actually make the changes.
Okay, so make that change.
Make the change and come out. People with epilepsy, please come out. We've seen what happens when people come out. It makes a tremendous difference. It changes the world, and the world needs change. Thank you.